Hindi movies in Bollywood or Kannada movies like Geeta and this Anand, where you want to kill off the hero or heroine, just give blood cancer and that's a death sentence. So from those days we progressed to now where no more is blood cancer a death sentence. There are a lot of curative intent treatments available, and trying to kind of pick up the disease early and treat and have access to whatever is the best treatment is the idea of making people aware and not labeling it as just a death sentence and saying you cannot do anything for this, just leave it, which is not fair. In today's world, with even our lifespans increasing in our country, we've moved away from the 50s to now 65, and most people now, you ask anybody, he always talks about living 75 plus, celebrating 80th birthday for sure. So this is the population which will also be prone to cancer, and this is one of them. Even though it's not in the top of the list, but it is something which is very life-threatening quickly, and thereby quick diagnosis, access to good treatment, and with the curative intent treatment which can induce either chemotherapy or sometimes even a bone marrow transplant is required. But all that is available in the country, provided you get access to it quickly.
So we always used to say blood cancer, right? So blood cancer is like a basket of diagnosis. There are different types of blood cancer. There are blood cancers which are more common among children. There are blood cancers which are more common among adults. So there is acute lymphoblastic leukemia, acute myeloid leukemia, and to put it in perspective, it is very, very rarely discussed in the press also. We just say generically blood cancer, and it is a very difficult disease, but it's not like that. There are the cure rates, if you take in the children with blood cancer is around 70 to 80 to 90% actually in good hands. So we are talking about a disease which can be completely cured if detected early and treated well. In the adults also, the treatment of blood cancer has evolved. Like when me and Dr. Sharad we were getting trained, the only treatment was giving chemotherapy. Then during a period of time, we knew that acute myeloid leukemia, what we are talking about now, one specific type can be treated with a tablet actually. And that has revolutionized the treatment of that blood cancer. You don't need to take any chemotherapy there. It can be completely cured by taking tablets, and the patients just live life normally. And the cure rate in that particular blood cancer is more than 90%. Now we are talking about the other types of acute myeloid leukemias. There also, large majority of the patients used to be sent home from many of the bigger centers, saying that you can't take treatment because you are elderly, you can't take high dose. So in those situations also, there are newer medications which have come. These are not chemotherapy drugs, so they don't give you too much of side effects like chemotherapy. They can be taken by even elderly people, even people like Dr. Sharad said, people like 70 years, 80 years, they can also be treated, and life can be prolonged meaningfully for years actually. Otherwise, before these drugs came, these patients could not even live for 2 or 3 months. From there, we are talking about living for years together with good quality of life. So it is important to talk about acute myeloid leukemia specifically in this subgroup of blood cancers, and also to talk that there are newer treatments, targeted therapies, which can actually make treatment also more easy for the patients and for the physicians, and outcomes are actually better than the previous treatments.
Dr. Sharad Damodar, I'm the head of adult hematology and oncology at the Mazumdar Medical Center in Narayana Health City. This month is Blood Cancer Awareness Month, and in view of that, we thought it's important to educate patients and the society about one type of blood cancer called acute myeloid leukemia, which is generally a death sentence if you looked at it a few years ago. But now with some of the newer modalities of treatment, including newer drugs, targeted drugs, and early diagnosis and subtyping, we can actually cure this disease with pretty good rates of cure with either chemotherapy or in some people requiring a bone marrow transplant. And that's something which is easily available now in our country at multiple centers, and thereby it is something we should certainly treat. Even older people with the disease can now be treated with a reasonable quality of life, and that's an important message we want to spread to our society.
Dr. Prasad Narayanan, I'm the Senior Consultant Director of Medical Oncology and Hematology at Side Care Hospitals in Bengaluru. Today we are talking about one disease which is very much misunderstood and not talked about much, and that is acute myeloid leukemia. It is a rare disease, but it affects a lot of people, it affects a lot of families, and there are a lot of misconceptions about this disease. So through this awareness meeting, what we are trying to say is that this is a disease which can be treated well. There are so many newer treatments which are available. There are safer treatments which are available, and a large majority of these patients can be cured, even in the elderly stage. So we have newer treatments which are less toxic to the people and which are more effective. And the message that we would like to give through this meeting is that we should talk about this disease. It is not just generic blood cancer. We are talking about acute myeloid leukemia, which are of different types. Some of them can be treated even with a tablet-based therapy, and many of them can be treated with targeted therapies with very good outcomes. Thank you.